Welcome to the River City Hardball Podcast. I'm your host, Andrew Gibson. Always a great pleasure to visit with our friend Jacob Evanich from Optimized Physical Therapy and Sports Performance. You've got a wedding coming up, man. Tell me about that. That's exciting news.
Yes, sir, man. So Sunday is the big day, and
Wow.
we're going up to Indianapolis, my homeland, and we'll get the job done. Can't wait.
You're not a Colts fan, are you?
Oh God, no. No, I would never do that. I was
Yeah,
a
you
Bears
got
fan growing up. Now I'm a Jags fan because I live down here. So I switched over, but grew up a Bears fan. Thank God, not a Colts fan.
well, all the best to you and your bride coming up on Sunday. Congratulations.
Thanks,
I've
Gibby.
got a wedding myself coming up in March of next year, so I'll have to lean on you for some pointers on what that experience is like.
Yeah, man, I'll talk you through the whole process. I got you.
All right, sounds good. So tonight we want to focus on oblique injuries in baseball. You know, we've talked in recent weeks about injuries that are specific to certain sports, like you probably hear more about ACLs in football, Achilles injuries in football and basketball. I feel like oblique injuries are pretty common in baseball.
Yeah, absolutely. I think you hit it on the head just with the rotation, any kind of rotation sport. So actually, yeah, baseball, and it's interesting. There's actually a lot of studies on cricket players because they also it's actually relatively similar, the movements they end up going through. So yeah, definitely a rotation sport injury, and pitchers are definitely a little bit harder hit with it. But still, with batters, same thing, rotation during the swing constantly. It can definitely hit them too.
Tell us what the oblique is. What is the function of it?
Yeah, so your core is made up of a lot of different muscles. So the internal, external obliques are the two obliques we'll be talking about. You have something called your rectus femoris, which is rectus abdominis, which is the muscles you think of like a six pack. And then you also have your transverse abdominis, which is a little bit deeper, which really helps with a lot of the stability. So the big ones with the stability and the rotation are the transverse, which really just keeps everything tight. And then the internal, external obliques both help with keeping everything tight and stable. They also help you lean forward a little bit. They can help you lean over to the side, and they help with the rotation. So they do all those.
You know, obliques are a tough injury to come back from. It feels like a tough injury to rehab, aren't they?
Yeah, absolutely. Really, when you end up having it happen. So first of all, when it happens, a lot of times we've seen it on TV. You see a guy swing, and all of a sudden he's just holding his side, and you know immediately, okay, oblique. So it's not too hard to diagnose it. It usually happens on one pitch or one swing, and the guy always kind of holds up by his rib cage because that's where they attach, and that's where they usually get injured. And then a medical professional like myself, if you're going in there and trying to test it out, you maybe have them, lean over a little bit, rotate a little bit if those were kind of uncomfortable. You could also apply some pressure and have them resist you to get those muscles working. And also, they'll just be tender in that area where the actual tear ended up happening. So, yeah, pretty easy to diagnose those for the most part.
You know, when we talk about specific oblique injuries, I remember last postseason, Adam Duvall for the Braves was injured during the playoffs in October. He strained his left oblique, and they never saw him again. They couldn't get him back. He had to be left off the NLCS roster, and that was a huge blow to the Braves as they made a playoff run last year. It's just one of those things when it happens, it takes a while to get back from, doesn't it?
Yeah, it does. And it depends on what actually happened with the injury. So it can be the muscle only. So there's always different degrees of the strain. It can be slight. It can be pretty severe where you tear the majority of the muscle. Also, because it attaches to the bone, sometimes if it's bad enough, it can tear away some of the bone with it and cause a little bit of a fracture or a little bit of the cartilage, kind of the smooth surface of the ribs. It can take a little bit of that off. When that happens, that's when you're really thinking a little bit longer of a rehab. With it, most of the time you're thinking about 4 to 5 weeks. Hopefully they can come back. But when you initially have these injuries, even when you cough, even when you're breathing deep, you're having pain with it. So you have to make sure that goes away first. So it is a lot of rest. you end up working a little bit more mobility to make sure the ribs are moving good, middle back is moving good. So by the time that muscle does heal up, and there isn't any pain, you're moving well at least, but then it's time to build up the muscles a little bit. So initially, you're right. We can only really work a little bit of mobility because we want the muscle to rest. But at the same time, we'll do some soft tissue things like massages and everything. Some other modalities are out there as well that can be used, but a lot of massage to help the healing process a little bit, and maybe some light exercise to just get the muscle working enough to where it will help heal the healing process of it all.
One of the more, I feel like, extreme examples of an oblique injury is what we've seen this year with Jack Flaherty from the St. Louis Cardinals. He's been out since late May with an oblique strain, and that has to be of the severe variety.
You would think so, yeah. Or just whenever he starts back up, maybe he keeps kind of tweaking it a little bit, so he keeps getting that pain and has just constant setbacks. But luckily, he is in a rehab assignment now, so he's right on track with the final step of coming back finally. Which for the Cardinals, hopefully, it's not a little bit too it's not too late, because I think they're 8.5 games back as of today.
Yeah,
so it's going to be tough to come back, and the rest of their pitching staff isn't doing very well this year. Yeah, so after everything heals up initially, then we're looking to get a little bit more dynamic with working that muscle, with a little bit tougher exercises with some plyometrics and things like that. And then you're gradually going to get back into a little bit of a throwing program. And once you prove that you can, or a hitting program if you're a hitter, and kind of gradually increase how many swings, how hard you're swinging, or how many pitchers you're throwing. And then the final thing is, they're like with Jack, and the reason why a lot of guys have the minor league rehab assignments, to try to keep the intensity down a little bit. When you're first coming back to game action, it's ideal to be playing at a little bit of a less level competition, so that you're not going completely all out and having that muscle try to do something it hasn't done in a long time. So gradually get it back into full playing shape. So seems like his last rehab start was actually really good. So it sounds like he's supposed to be coming back in the next, I thought they said about a week or so, but as long as there's no other setbacks, which is awesome.
Yeah, I saw today, Friday, is when he's expected back this week. So
okay. That's awesome.
I know you hate to see the Cardinals struggle as a Cubs fan, though, right?
Dude, I can't believe what happened. I'm still trying to get over the whole trade deadline. So.
I can imagine. I really can. That's maybe something that you hardly ever get over. I mean, it's probably going to stick with you for a long time.
You're right. I got a long life, hopefully a long life left to go. But man, I will not forget that trade deadline.
Yeah, it's brutal for Cubs fans everywhere. That's for sure. So is an oblique strain for a batter more severe? I guess it depends on the case, but is it tougher for a batter or a pitcher to come back from an oblique strain?
Always, it depends on the severity of everything. It seems like pitchers do get injured a little bit more with it. Also, when you have the oblique injury, the MLB, they have they finally started in the 2000s to track injuries a little bit more in depth to get an idea of what's really keeping these guys out. With the oblique injuries, when they came back, well, first of all, the obliques are 5% of all injuries. So you're talking about 1 in every 20 injuries, which is pretty significant. And when they come back, you're looking at in the first, that season or the next season is when you're most likely to have it happen again. Have a little bit of a setback, and about 12% of guys coming back from that injury end up having it happen again, with a third of those being pitchers. So the majority seems like it is pitchers, but it can happen to anybody, of course. But 12%, I mean, that's a pretty significant number in itself to have a setback. You're talking about a little bit over 1 in 10. So, yeah, it's tough.
Is the reason that it happens so much to pitchers, is that because of the rotation and like the exertion that they have doing that?
Yeah, absolutely. So the obliques, they attach from your hips to your rib cage, and they're the ones that's generating a lot of that power, along with they help with the stability to transmit that power from the legs through the arms. With that, Dang, man, I just lost my train of thought.
No,
It's
that's all
so
right.
late.
Well, with the oblique strains that we talk about, I just feel like that's one of the more nagging injuries that you see. I mean, hamstrings are up there, but obliques have to be one of those that you just see, that you just mentioned it. The chances of a repeat injury are, kind of significant for that.
Yeah, they absolutely are. With the pitchers, what they end up, why they end up getting injured a little bit more is a lot of that force is generated when they're kind of in that cocking phase into the acceleration of throwing. So when their arms kind of back in that cocking phase, and then they go into the full throw, that's when your hips are dissociated. So the hips kind of turn forward first, and that keeps the shoulders back. And that's where we generate a lot of that power, kind of like a rubber band almost. So at that point, those obliques are on major tension at that point, and then that's when a little bit of the tear can happen.
What, as we wrap up here tonight, what are some, methods of rehab for an oblique injury? Are there any specific lifts that we do? I know that's one thing we've learned, is that specific lifts aren't necessarily what it takes. It's a full body movement, right?
It is, yeah. So we want to make sure your core is really strong. That's the main thing to keep these things from happening. We need to make sure we check when these injuries happen. They happen on one pitch or one hit or one swing, but we want to figure out what the underlying cause is. Is it a little bit of mobility issue? Is it a core stability issue? Is it just a mechanical kind of issue, putting a little bit more stress on those muscles? But the big thing is we really want to make sure, yes, your core is really strong, and that we are doing exercises to not only, like you think about planks, that's more like a neutral position. So that's what we would start with to make sure we're working the core, because that's kind of the foundation. From there, we would do some things like, chop exercises where you're getting a little bit of rotation involved with that. And that's really what would train those muscles, a lot of the rotation, and kind of, we do a lot of chop variations when we're loading up with a little bit of weight to train that.
I feel like, so like tossing a medicine ball up against the wall, is that one of those that would help?
That's another one too. Yeah, absolutely. So pretty much we never go a session without doing some kind of med ball tosses to work that power. And yes, core, and just the hip dissociation is so big for hitting and pitchers. Like I was talking about, that little bit of hip turn before the shoulders go into it, and med balls are a great way to really train that. So yeah, absolutely. And if we were like rehabbing from an oblique injury, that would be kind of the last step before you're going into your rehab assignment to actually start pitching off the mound and everything. You'd be doing higher level stuff like the med ball tosses. So yeah, absolutely.
Good stuff. I've got a little experience doing the med ball stuff a
Do
little
you?
bit. I always like to do those, man. They're like good for your core, I like that.
Yeah, no, it really feels good. And I mean, you can let a little anger out too, trying to throw it through the wall.
Yeah, thinking about all these trades for the Cubs. No, I'm kidding.
Yeah, exactly.
Hey, as we wrap things up tonight, man, tell me about DBAT. What's been going on there? I've heard that you've had a little spike in guys coming in. That's good news.
Yeah, and it's a good time for people to be coming in, because we're going from the spring and summer into the fall. Yeah, we have fall seasons, but I feel like that's the best time to really get guys, make sure they're mobile again. We get tightnesses during the season, make sure we're really getting our full strength back and getting even stronger for the next season. So I feel like this is the time to kind of make moves with how strong, powerful, and how well we're moving to really get ready for the next year. So that's what we're getting a lot of. Some people just with some aches and pains after the long season that just happened. Other people just really trying to take the performance to the next level. So a good mix of both, which keeps it fun. And yeah, very fortunate to be getting to work with the awesome softball and baseball athletes here in Jacksonville.
Yeah, and I heard Zach was telling me this week from DBAT that they just brought in Dakota Jalila, a 5-year starter at shortstop for Jacksonville University. So it's cool. I love that they delve into the local community and find people at JU and things like that to help out the cause there at DBAT and what you guys are doing as well. Love to partner with you guys and love to see all that kind of stuff. Check out Optimized Physical Therapy and Sports Performance on Facebook and Instagram, optimizedptsport.com. As always, enjoy the conversation. Thanks so much, Dr. Jacob Evanich. We'll see you next week, man. And once again, best of luck in your marriage. You got a wedding on Sunday, man. Go out there and do the thing.
All right. Thanks, Gibby. Appreciate it.